The opioid epidemic is the epidemic of our lifetime. This is our generation's HIV or Black Plague.
The opioid epidemic is a little bit different in our rural areas than it is in our urban areas because our people out there that are seeking these pills, they can go to a doctor in every rural town that has a clinic or a hospital or an emergency room has a doctor in there that's able to prescribe them these pills. And if they exhibit the correct signs and the doctor feels like that's the best method of treatment, they can get opioids.
In the late 90s and early 2000s, there was a big push to identify patients that were undertreated for pain. And so providers, kind of the pendulum swung a little bit, and providers then became very aggressive in treating pain. Patients would come in expecting that their pain levels would be zero, when in reality, we really shouldn't be getting them to zero. Pain is a subjective measurement, and so it really goes on a scale that a patient would tell you, yeah, I have a lot of pain, I have no pain. Very different than, say, a blood pressure, where you have a blood pressure, you take a pill, and you get it to a goal. So pain is very challenging to treat because it's very subjective as related to other diseases that may be more objective measurements.
The human side of the opioid crisis, the opioid epidemic, is tragic. Oftentimes our friends and our family and the people that we're closest to are affected more by this issue because of the addiction, because of what the addiction does to these people. It tears apart our relationships, it tears apart I guess the moral fiber of that person's network. They lose jobs, they end up becoming homeless because they put so much effort into trying to find these drugs, or they're so addicted to these drugs that they can't really work day to day. They can't really comprehend what's going on, and they just become a sort of a drain on society while they're addicted to these drugs.
When opiates are filled, sometimes other members of the family, other people steal those opioids and use those in inappropriate manners and become addicted because they're stealing those medications and taking them, selling them. Those types of behaviors do exist.
Oklahoma State University has realized that if we're going to get ahead of this epidemic, we've got to come at it big and strong. We're doing this by the creation of a Center of Wellness and Recovery. This comprehensive center will hit on the areas most needed in order to battle this problem. This includes research, education, clinical services, and advocacy. We realize now more than ever that addiction is a brain problem, and it's not a personal failure. If we're going to help individuals struggling with this, we really have to find out the biology that creates the addiction in the first place. OSU Center for Health Sciences is bringing together an impressive team from around the state of Oklahoma to focus their research on addiction.
The risk of not doing anything with this problem is unfathomable. Every day we see more and more stories out there in the media about somebody who's overdosed, whether or not it's on heroin, which is an opioid. You see the videos of the people that are overdosed with the kids in the car, or we see the overdose deaths related to that, which are on the rise in Oklahoma. Our overdose deaths related to opioids are increasing year after year. Not doing anything about that is just not acceptable. There's just no way that we can solve this problem at all without taking a firm stance against it and trying to develop avenues to help solve our problem.
One of the biggest challenges facing Oklahoma is the shortage of providers that are educated in addiction medicine. Often these individuals, if they do exist, they're consolidated in the large cities like Oklahoma City and Tulsa. We have discovered a way to reach these individuals with the most up-to-date evidence-based practices using what's known as Project ECHO. Project ECHO allows our experts here in Tulsa, including an addictionologist, a psychiatrist with expertise in addiction, a case manager with expertise in addiction, and a licensed alcohol and drug counselor to provide weekly consults with real-time recommendations to primary care doctors, nurse practitioners, and other clinicians around the state of Oklahoma. This prevents patients from having to travel hours and several hundred miles while waiting several months for an appointment.
Because we know that people tend to do better when they're receiving care in their community by a doctor who understands their family, understands the communities that they live in. So Project ECHO is a way really to help support physicians who are already practicing in those communities and give them all the knowledge and skills that they need without requiring them to leave. I grew up in rural Oklahoma and I live there now with my family. My values and my upbringing were there. I embrace that lifestyle and I truly want my family and future generations to be able to enjoy rural Oklahoma and agriculture.